The Director General of WHO, Dr. Tedros, made a plea, I believe it was last week, don't politicize COVID. This is not a political issue. COVID does not respect national boundaries. It does not respect political affiliation. It does not respect religious affiliation. It infects everybody from prince to pauper. That is the context in which Trinidad and Tobago has been carefully laying out its plans to combat COVID-19 in Trinidad and Tobago. But there are some persons in Trinidad and Tobago with political aspirations who are intent for their own short-term political gain to capsize this. The trust that exists between the government and the people of Trinidad and Tobago in the fight for COVID-19 must not be broken. And today I am speaking directly to right-thinking citizens of Trinidad and Tobago. I have before me a letter penned via the Ministry of the Attorney General and Legal Affairs, very urgent, to Mr. Gerard Ramdeen, pre-action letter in the proposed action on behalf of a gentleman. I will not call his name, because I believe when I took an oath of office as Minister of Health that patient confidentiality and the principle that goes with that must be applied in good times when it is convenient for me, but also in bad times when it is inconvenient. That's the principle on which we stand. And nothing will lead me to call a patient's name in the public domain, no matter how politically expedient it is. Because if I do that, the entire healthcare system will have no confidence in the government or the Minister of Health to manage their affairs. So on behalf of somebody versus Dr. Roshan Parasram, the Chief Medical Officer, I will read some excerpts from it. Please note that at the time of writing this letter, your said letter to Dr. Parasram has not been received by him, but has come to his attention to the courtesy of members of the media who have given wide national coverage of it last night. If this is the way political aspirants are going to treat with the issue of COVID-19, then we're in a very bad place. The letter goes on to say about the factual inaccuracies, premature, threatened action. Paragraph 1 goes on to say, as you are aware from your personal involvement, that is Mr. Gerard Ramdeen's personal involvement in this matter over the period March 24th, 2020 to date, it was your client, Mr. Whatever, who contacted the Honorable Minister of Health, Mr. Terence Dial Singh, by telephone on March 24th, 2020. And the Chief Medical Officer will tell you what is the protocol to contact people when they have a positive test. The Minister of Health never had, has never asked, or inquired about who has tested positive. It is simply not my business. It is not my business. I get no heads up as to who has tested positive or not. I called no one. And I'm willing to turn over my phone, cell phone, and my landline records to the relevant authorities to prove that to the public. The Honorable Minister of Health specifically informed the gentleman that he knew nothing of the matter relating to his medical condition, and in particular that he knew nothing of the gentleman being tested for COVID-19. But what is more disturbing is paragraph 5. Subsequently, you, meaning Mr. Gerard Ramdeen, you called the Honorable Minister of Health, and my phone records will bear that out, and informed that you were acting on or behalf of Mr. X. Thereafter, you, Gerard Ramdeen, personally coordinated your client's voluntary admission into quarantine, going as far as to send the gentleman's address to me via WhatsApp so that he could be appropriately transported and transferred to a healthcare facility. It was the gentleman's lawyer, and my phone records will bear that out, who WhatsApped me his client's address. So let's review the factual matrix so far. The Minister of Health gets no first-hand information, prior information of the health status of any COVID positive person. The gentleman in question reached out to me. Then I would have returned a call to him. I did not instigate the telephone conversation. And then Mr. Gerard Ramdeen acted as go-between. Paragraph 11. The combination of your client's own dissemination of dramatic videos to the public on the night of March 24, 2020, after he expressed fear of the public embarrassment and the need for confidentiality, coupled with the dispatch of your own letter to the media tonight, before delivery to the Chief Medical Officer, can easily lead one to believe, quite regrettably, that the theater of public and political spectacle seems paramount to your client. Surely, it cannot be lost upon the average observer that both your client and you, yourself, have been active politicians for the Opposition United National Congress. Ladies and gentlemen, fighting this in the public domain will lead to one thing and one thing only: the virus will win. And when the virus wins, the numbers I called at the start, 2 million cases and 128,000 deaths, our contribution to that will go up significantly. The specter of publicizing pre-action protocol letters in the media before we at the ministry even have a chance to receive it is to be frowned upon in the strongest language. We can accomplish much more as a society by working together. This is a time to put away the political weapons of mass destruction. If we don't do that, and we don't get all sectors of the society in lockstep to fight against the virus, we will fail. Let us save our energy for the fight against the virus and not the fight in the courtroom. The fight in the courtroom, the virus will laugh at us, because we at the ministry and the government have to be working 36 and 48 hours a day now, not 24 hours, to keep this country safe. Our workload, and I make no complaint, our workload has increased tenfold, but we still have 24 hours in the day. And these side shows and freak shows are not in the public's interest. I implore all who seem hell-bent on reaping some sort of ill-gotten political reward out of this, that you are not acting in the best interest of Trinidad and Tobago. We are all in this together. Let us unite under one flag. Let us unite under the banner of our watchwords: discipline, production, and tolerance. And if we do that, as we keep saying, we will come out of this tempest much stronger and be a shining light to the rest of the world. However, if we allow divisive politics to separate us by those who have no interest in a national response, the virus will laugh all the way to the bank. And our contribution to 2 million cases and 128,000 deaths will be stellar. Will be stellar. We would have succeeded in destroying ourselves if we allow ill-informed politicians to bring this whole carefully planned response upon our heads. A word to the wise, this is not a political issue. This is a national issue that requires a national response. Thank you very much, Minister Cox.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Minister Cox, Honorable Minister Dial Singh, members of the viewing and listening public. As of the 15th of the 4th, 2020, the clinical status update is as follows. 1,282 tests done so far, 114 positive persons, 8 deaths with 19 discharges. We would have had 2 discharges that occurred last night, or yesterday and last night in Cora. The total number, leaving the total number of hospitalized patients between Cora and Cuba at 60. Cora now has 12 persons hospitalized, all ambulatory, all stable. Cuba has 48 persons there. The ICU has no one at this point. However, the HDU, which is the high dependency unit, has 2 persons. Subsequently, I think yesterday there would have been 4 persons there. So a total now of 46 persons are now ambulatory in a fairly stable position. In the Sangre Grande facility, we have a decanting that occurred. Has 26 persons at present. Within the suspect ward at Cora, there are 2 individuals there. By way of public health surveillance, we just want to continue that the key tenets of this fight remain hand washing, using hand sanitizers as necessary, coughing and sneezing into the crook of your elbow, ensuring that you wear masks as we had discussed previously to limit spread, and of course the measures that we put in place in terms of social distancing. Thank you.
Thank you very much, Doctor. Dr. Lisa Indar, the Assistant Director, Surveillance, Disease Prevention and Control at CAFA, will be joining us by telephone to update on CAFA's testing and discharge protocols. Dr. Indar?
Good morning. A pleasant good morning to all.
Good morning.
I have been asked to address the issue of testing protocols at CAFA. I'm presently participating in the CARICOM Heads of Government meeting, so apologies in advance for leaving after this presentation. The CAFA Medical Microbiology Laboratory is the regional reference laboratory, and it currently conducts tests for suspect COVID-19 cases for member states using the WHO recommended testing protocol. The laboratory currently tests all suspect cases that meet the criteria as recommended by the WHO case definition. Currently, samples can only be sent to CAFA from the designated National Public Health Laboratory in a country. So for Trinidad, this means the Trinidad Public Health Laboratory. Once samples are received, CAFA will produce the results within 24 to 48 hours. The COVID-19 results are immediately sent to the chief medical officers at the Ministry of Health, who are then responsible for dissemination. CAFA cannot and will not disseminate any country's results directly to patients or individuals. It is an ethical breach and constitutes a violation of the agency's ethical standards to share confidential patient information with unauthorized persons. The method used by CAFA is the WHO recommended polymerase chain reaction. This remains the gold standard for COVID-19 because the sensitivity and specificity are both 99.9%. CARPA laboratory has all the positive and negative controls to ensure all results are accurate. With respect to testing protocol for discharge, the universally accepted criteria for discharge for a person who tested positive for COVID-19 is 2 consecutive negative results separated by a 24-hour period. But what does this mean exactly? First, if a person is tested positive for COVID-19, they would be required to be isolated at a government health facility for a 14-day period before any repeat testing can be done. After that 14 days, the COVID test will be repeated. If repeated and it is positive, then that test will then be repeated at a 7-day interval. This will continue until the first negative result. Once that patient is tested negative, a next test will be done 24 hours after. Following 2 consecutive negative results, the person would have met the universal criteria for discharge. So to emphasize, the first set of testing for COVID positive case to meet the criteria for discharge cannot be done until after 14 days of isolation. Following that, if that person is tested positive again, they have to wait for another 7-day interval for a second test, and that will continue until we get until there is a negative test. Thank you very much for your attention.
Thank you very much, Doctor. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the poll and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
Good morning, Ministers.
Morning,
Stephen.
Mr. Cummins.
Good morning.
2 quick questions. We are seeing a number of persons who may be taking the opportunity to lawfully challenge both the Public Health and Quarantine Acts of Trinidad and Tobago. Persons claiming that their constitutional rights may be infringed during this COVID-19 period. Can the government make it possible for further clarity to be made on these 2 critical pieces of legislation, so that both the public and individuals under the banner of suspect COVID-19 be clear on rights, privileges, and powers?
So we will ask.
I think he has a second question.
Oh, sorry.
Second question. Dr. Parasuram, yesterday you began your expanded surveillance testing initiative. What have medical personnel been picking up so far as it relates to data that could prove to be useful in the fight against COVID, and possibly data that could find its way into future policy decisions?
Okay. So I will take the first part of the question. The Honorable Attorney General will address the issue of constitutionality, and I will leave that for his expert opinion.
Right, so in terms of your second question, we did start yesterday the expanding surveillance testing as we discussed. So basically, just to reiterate exactly what is being done, it is not a new scenario that we are doing for the first time as it relates to COVID. It is something that has been done from the surveillance department in Trinidad and Tobago for quite a while, a number of years now. So what we do is random sampling of persons with a category of illness listed on the surveillance form called acute viral illness, which is AVI. So we are taking 1 sample per day from the AVI group that we have per health center. So we have designated a health center within every county of Trinidad, Trinidad and Tobago, so that we can actually do surveillance. So the physicians in those facilities will select someone that meets the criteria for acute viral illness. They will take a sample from that person and send it on to the lab. listed on the top of it, they will say for surveillance purposes, which means that it does not have to meet the case definition and therefore would not be rejected by CAFA. So I have had the discussion with CAFA and they will accept those tests from us beginning yesterday. The first group would have been taken yesterday. We will await the results. So in terms of results, we would not have gotten results as yet from that group. So as soon as we get those results, we can disseminate what we are finding. But what we're looking for beyond COVID is we're looking to see what else is in circulation in the country, whether there are other types of viruses, respiratory and otherwise, that are circulating, to see what is making up all or comprising the group of acute viral illness, as well as what else may be H1N1. We are still within the flu season. What other viruses are circulating around?
Thank you very much. Rashad, Guardian Media.
Hi, good morning, everyone. Rashad Khan, Guardian Media.
Good morning.
Morning.
Just permit me 2 questions here. So first one is, have you received that report as yet from the ERHA, Minister Dialsing? And also my second question now, has a few parts, but I want to know, I mean, you already addressed the patient, he who shall not be named, and all these things. I've taken a look through the letter that the AG sent to Mr. Ramdeen, but within the video that was shared on social media quite a few times, there was some concerns and I think has some implications for the public. And one of that is, how could a patient who is awaiting that second negative test that you all have spoken about that would require them to be discharged, how could a patient awaiting that test be given discharge papers? Because now it begs the question, could that have happened anywhere else? Could that kind of mix-up happen with any other patients? And also with the issue of confirmation, is anything being done to get that in writing from CAFA? Because that person is not the only person we've heard complain about that.
Okay, so I will take the first part of the question and the Chief Medical Officer will take the other parts. The report reached my desk just about 5 minutes, about 9:30, just as I was leaving to come here. I haven't had a chance to read it as yet, but that's the first thing I do when I go back to the office after this press conference. Chief Medical Officer.
Okay, so in terms of any sort of testing that happens, there's a relationship that CAFA has with the institutions, CUVA and CORA. They both have medical directors. I have already reached out to the medical director of CORA. So CORA will actually be producing a report for me, hopefully by the end of today or tomorrow, together with my Trinidad Public Health Lab. And as Dr. Indar would have said, they only receive tests from Trinidad Public Health Lab. So the way it goes is it actually goes from our institutions, any of them, to the Trinidad Public Health Lab, who receives it and helps prepare the tests. And that basically goes to CAFA thereafter. CAFA will run the test. They will send the results through Trinidad Public Health Lab backwards. And that is then filtered to all the institutions in the country via their lab managers. So that is the process for disseminating results. I have asked for a detailed report stating what happened in this particular case, where the report would have gone, who would have viewed the report, that sort of thing, which I hope to get in the next few days. And then we'll be able to make some definitive statements as to what occurred.
Thank you. Express.
Can you hear me?
No, we are hearing you now.
Yes.
Good morning.
Camille Hunt, Express.
Yes.
Good morning.
Morning, Camille.
Following up on Richard's question a little bit, I understand the principle of patient confidentiality, but given the public manner in which this whole situation is playing out, can anyone tell us, has the particular patient, has he tested positive or negative at this time?
Okay.
And
sorry.
And in no uncertain terms, did CAFA make an error in his results?
Okay. So the public manner in which this has been handled is not due to the Minister of Health, the Chief Medical Officer, or any other agency. This was voluntarily done in a most reckless manner from day one. Let me put that on the record. This public show, this freak show, that took place from the 9th of March 24th, and then the leaking of a pre-action protocol to the chief medical officer before he even had sight of it is the modus operandi of certain people. Neither the Minister of Health nor the chief medical officer will talk about tests of any individual. Let me reiterate, from day one, the issue of patient confidentiality is the bedrock of the healthcare system. I ask you, any member of the media, would you like me to say whether Pryor, Richard, Christopher, Lasana has tested positive or negative for COVID? You would not like it. So the constant asking about the health status of any patient will not be entertained. We have to be very clear on that, and the chief medical officer can answer the other part of the question.
So just repeat your other part of the question, please. Can you? From Express.
I was asking if, as is being claimed, did CAFA make an error in this particular patient results?
Again, as I said to Richard, we have asked for a full investigation. A full investigation doesn't only stop with the Trinidad Public Health Lab, it goes on to CAFA as well. So they would have a part to play in terms of the report, and once we get everything with clarity, we'll be able to say something further.
That's it. Then we move to Peter Christopher, Guardian Media Limited.
Hi, good morning.
Morning, Peter.
Minister. Good morning, CMO.
Morning.
I have a couple questions.
Sure.
With regard to a couple of my colleagues have asked this question a couple of times concerning the number of tests. We wanted to get some clarity with regard to the number of tests that are published in the update. How many of them, are any of them retests of patients who previously tested positive? And
You said that before.
account for that number? And I just wanted to revisit a question I asked yesterday concerning the outpatient clinics. I revisited the presentations from the Dr. Kelly and such, and that mainly dealt with cancer patients and neonatal clinics. But there were some clinics in San Fernando General Hospital, eye and heart patients or patient clinics that had been postponed. I wanted to get some clarity if those clinics had been reviewed as well.
Sure. Okay. Right. So in terms of the first question related to the number of tests, I had asked a couple of days ago for a number of retests to see how many people were retested. I think Minister would have given the number of 84 on air. Out of then, I believe it was 1,191. So we would have had 84 retests in that group. So on a daily basis, I don't ask to see the number of retests, but it would have gone up by a handful of people over that period of time, and we can get a new number if you like. But that just gives you a proportion of how many of the people are actually retested. With regards to the clinics are still functioning. We are making sure, importantly, that they may not function in the same light that we are seeing every person within a cubicle. What we are making sure is that the persons that are well and returning for their prescriptions, that they get their prescriptions filled. They have all their medications to last the period in between their transition, which is normally 2 to 3 months. They have a prescription refilled, and that they all have their medication. Of course, if anybody is acutely ill, we have the enhanced health centers, we have the district health facilities, as well as the A&Es throughout the country. For instances, if you have uncontrolled diabetes, uncontrolled hypertension, you can visit these places as per usual in between.
Minister, you had a part to answer in that question, or you okay?
No, I'm good, thanks.
All right, thank you. We go to Tobago Channel 5.
Good morning, Minister.
Morning.
Mike Jackson from Tobago Channel 5. My question is in regards to nursing homes. Of course, we know that persons are not allowed to visit the persons that are in nursing home, whether they be family or whatever the case. But it's been my understanding that if a person in a nursing home needs to go visit the hospital or a clinic or whatever, it is up to the family members, is the responsibility of the family members to take that person over to the clinics. Now, I was wondering, isn't that a risk in a way, because then you're exposing this person to persons outside of health officials, and you would exposing the elderly person as well as the family members of this person for a potential infection or whatever the case may be. So I was wondering, is there any consideration being made to providing perhaps ambulance or whatever to take these persons to the clinics and whatnot to get the treatment that they need and bring them back to the nursing homes instead of leaving it to the families?
Okay. Right. So your question basically, there are a number of nursing homes in the country. Some of them are private. Some of them get subventions from the state. Most of them, if not all of them, have a physician that is assigned to them. And that physician actually goes into the facilities in the event that someone gets ill, and they do an assessment. If someone is deemed to be critically ill, the ambulance services, which is the routine ambulance services that operate throughout Trinidad and Tobago, actually take persons from the nursing home straight to the facilities. So that is done. The majority of mild cases of illnesses can be dealt with by a primary care physician who would visit the centers. So there's that in place as well. Very rarely now, during this period, we would ask relatives to come in and take someone to the hospital. We would prefer, and we are trying to get the physicians to come in and see someone. And in critical cases, we will have the ambulance actually reach out and take them to the facilities. And that has been in place even before COVID.
New source?
Hi, good morning, everyone.
Morning.
I have two questions.
Sure.
One for the Minister of Health and one for the CMO.
Please identify yourself, please. Identify yourself, please.
It's Rhoda Barrett. Good morning, Minister.
Morning, Rhoda.
The question I have for you is really something that I want you to pass on to your legal colleague, please, the Attorney General.
Sure.
Can you ask him to weigh in and let us know whether or not there's any legislation for persons who spread a deadly disease either deliberately or through irresponsible behavior, because I'm not sure if there is an act that covers it and where exactly. For the CMO, I've got this question. I think that there is a certain amount of confusion in the public domain right now about a distinction between the number of samples submitted to CARFA for testing and the number of tests done, because people are hearing the data on a daily basis, and they're hearing about the number of tests that have to be applied to patients or to possible positive patients. And for them, when they hear the number of tests, they see the number of samples submitted, and then they see the number of positives, they're thinking that the data is not necessarily adding up. So if it is possible for you to rationalize number of samples submitted and the testing that is taking place alongside the number of tests, if it makes any sense to you.
Okay, so Rhoda, I will take the first part of the question. I will certainly pass on your inquiry to the Honorable Attorney General for his attention. Thank you.
Okay, in terms of the second part of the question, we're speaking to what we submit is basically the test that, as I described, goes through the Trinidad Public Health Lab, and they record it and they submit it to CARFA, and that is done we do a press release that says this number 3 times a day, and it will change based on the number of samples that are actually submitted to CARFA. I have just indicated the number of retests that we do. So basically, those are saying that the persons that would have been tested more than once. Aside from that, there's a number of other. So using the number of 84 loosely, or let us say 90 loosely, and we look at the numbers we have today, we're expecting that the total number of persons tested would be somewhere around 1,200, a little less, thereabouts. So in terms of data, is there anything else that you all would like to see to make any inferences from the data? Rhoda?
The thing is this, Dr. Parasram. According to the most recent press release, I'm seeing here 1,282 samples submitted.
Yeah.
But does that mean it's 1,282 tests that have been applied?
Right. So basically, at the beginning of the day, 8 o'clock and prior, so this first report that says 1,282 would be roughly about 830, the number of samples that are submitted up to that point in time. CAFA receives it, they test for the entire day, they do it in batches. The batches vary, depends on the number of tests that they get, the number of tests that they do for the day, and I'll give you an average. By the end of the day, generally, they have about 20 to 30 tests that are undone, which rolls over into the other day. So basically, they will test throughout the day based on their capacity and based on how many tests we actually submit to them. And then whatever remains for the next day rolls over into the following day and is tested. But generally, by the end of the day, they have a very small number. Within the last 2 or 3 days, they actually were able to complete the entire test that we submitted to them within the same day. So actually, for yesterday, there would not have been any that rolled over into today and the day before as well.
Loop Titi.
Hi, good morning. Cielo Felix for Loop Titi.
Morning.
Morning.
Hi, I was just wondering, we've seen a few cases now of people who have tested positive for the virus after a preliminary negative test. So I'm wondering whether there's any concern by the CMO or the minister that there may be some previously negative cases that may have to be retested now or should be retested now in order to eliminate any possibility that there are more positive cases out there that we're not aware of right now.
So as Dr. Indar would have indicated, the testing protocol is one. We wait 15 days after your initial positive to do a first sample to see if you're becoming negative once you have no symptoms. That is done, and that is, if that is negative, we do a repeat 24 hours later. That should be negative as well. If that becomes positive, then we actually wait a further 7 days, according to CAFA's protocol, to begin the cycle of repeating again. So, and really and truly, the reason we are being so onerous in the way we are waiting is to ensure that we are not getting false negatives. So we do a negative, then there's a positive that comes up after. We actually wait 7 days again before we retest to get our first negative. And it is for that very reason that we have seen a lot of times for samples that submitted in Cuba that we had a first negative, we tested 24 hours later, and then we had a second positive, and we had a positive coming up after a negative. And we have seen that occur more than once. So for that reason, CAFA has their guideline in place, which says to wait 7 days after you're positive, following a negative, and then restart. So we need to get a further 2 negatives 24 hours apart, but having waited the 7 days in between to ensure that we're not getting false results.
Thank you, Doctor. I would now like to ask Minister Diyal Singh to give us a few words on contraceptives.
Yes. So thank you very much. I forgot who yesterday asked a question about contraceptives. They wanted to know about other contraceptives besides condoms. So I do have the information for you. Stock of contraceptives in the population program unit, which is separate from C40, so that's another set of stock. This is just what is in circulation now, that are currently being distributed to clinics throughout Trinidad and Tobago are 4,600 monthly injectable hormone injections, 140 10-year versions of the intrauterine devices, 37,000 packs of oral contraceptives, each pack representing 1 month. Additional supplies and orders will be at C40 as more orders are being shipped and delivered. The Ministry of Health estimates that this represents ample supplies for our clients based on previous utilization patterns. And even if more clients come on stream over the next 6 months, we have at least 6 months minimum, even for more. Somebody asked yesterday specifically about diaphragms. I have been told the use of diaphragms was very low and was thus discontinued several years ago in the public system. Someone also wanted to know about the influenza vaccine numbers. The cumulative number of vaccines administered for the flu season this year is 110,775. The number of suspected cases for 2020, 595. We have 40,000 flu vaccines left, and this is a good time because we have noticed a drop-off in the uptake of flu vaccinations. This is a very good time for our elderly clients, especially those with pre-existing conditions like diabetes, hypertension, anything, to take advantage of the free service. We have 40,000 free flu vaccinations left for you. The flu season will end around May or June, CMO?
End of May. Yeah.
End of May. So these 40,000 vaccines, I would not like to have to destroy any. Let us try to use out all. It will give you life-saving protection against H1N1. And you will have the added benefit, and the CMO could back me up here, if you do get COVID, instead of fighting 2 viruses, you're only fighting 1. So your chances of survival are better. H1N1 flu vaccinations, 40,000 left. The elderly, the pregnant population, please make use of it at the clinics. Thank you very much.
Thank you very much. We go to 91.9.
Hi, good morning, everyone.
Morning.
Morning. Just a quick statement, Dr. Parashram. I think if we add to the data persons, the amount of persons who have been tested, because the test itself is one figure, but the amount of persons actually tested might be a good addition to give some information, and also some information on how many tests may have been rejected by CAF, or didn't go forward because we may have taken a sample and it wasn't tested. Sure. So that type of data might be a little bit more helpful in the releases. And just in terms of my question, Minister of Health,
yes,
could we get some clarity on why the ERHA was selected to really and truly handle these step-down and quarantine facilities, considering that Balandra and Sandy Grande are so far away from 2 of the main areas, that being Cora and Hoover? If you could get some information,
sure.
that would be helpful.
So step-down facilities are chosen by the Chief Medical Officer, the County Medical Officer, based on certain criteria, their distance from how the center is laid out, no immediate neighbors, the amount of acreage of land. I think the CMO would have said that in a previous press conference. So that is some of the criteria that we use: the availability of space, the availability of bed capacity in these facilities. So the CMO could possibly expand on that.
No, just to add, I mean, we did not choose Eastern Regional Health Authority. They were one of the first RHAs that actually were chosen for 2 reasons. The North Central Regional Health Authority is handling the bulk of the COVID-positive patients in their 2 facilities, Couva and Cora. So Eastern Regional Health Authority started up with Balandra in the first instance, and then they would have been able to get Sandy Grande up and running. Other RHAs are now being asked to get similar facilities up and running. Southwest is looking at a couple of facilities at present, which we hope to get up and running very soon. So the other RHAs are going to be getting step-down facilities up and running in short order as well. So it's not that Eastern is the only RHA that has been chosen to do so. All other RHAs will be given that opportunity, probably outside of North Central in the first instance, because they do have a heavy burden to bear with the treatment of positive cases. In terms of the choosing of the sites, they are, as Dr. Best would have given a good account of what we do when we choose a step-down facility, and really the CMOHs are the ones that are driving this from the county level, together with the CEOs of the RHAs. In terms of site selection, they do send reports to their CEO to make representation after doing a site visit, which includes themselves as well as the public health inspectors and nurses to their CEOs, making recommendations based on public health guidelines, which include things like ventilation, the site layout, the number of beds per occupancy. There is a critical portion that we have to take into consideration, which is the ability to be able to set up what we call hot and cold zones, meaning that when the staff go into the facility, there must be an area that they can use their PPE, put on their PPE, and an area for donning and doffing, taking off your PPE. They'll be looking at the grounds, the acreage that the land is on, whether there's other facilities on the ground that persons can have a little walkabout as well, because we're trying to bring them back into society gradually. So those kinds of features are being put in place. There is a template that the CMOHs use generally to assess them, and that's how we choose our step-down facilities.
Thank you, Doctor. I recognize ACP News.
Hi, good morning, Prior Bihari, ACP News.
Good morning.
Morning. Minister Diyal Singh, I just wanted to clarify concerning this unnamed individual. Are you saying that you never told anyone via telephone that they were COVID-19 positive? And my second question is, how can somebody have discharge papers and not be discharged physically?
Okay, so I will take the first part of the question, and the CMO will take the second part of the question. So let me just repeat what I said at the very beginning, and which Dr. Indar said, the CMO said. The Minister of Health receives no personal information about any patient. I receive no personal information about who is COVID positive or who is COVID negative. That falls strictly under the control and direction of CARPHA, Trinidad Public Health Lab, and the Chief Medical Officer. I have called, there are 114 positive patients. I can say truthfully that out of those 114, I never called any one of 114 persons to tell them their status. Two reasons. I don't know, and it is simply not my job or business to do that. You have public officers to do just that.
Doctor?
Yes, so in terms of your second question, you just want to repeat it quickly for me?
How can someone have discharge papers and not be discharged physically from?
Right.
From
so,
quarantine?
as I said before to two other persons, I asked the head of department, who is Dr. Trotman, to give me a written report on exactly what transpired. And once I get that, I'll be in a better place to give you all an answer.
Power 102.
Good morning, Head Table.
Good morning.
Susan from Power 102. Minister, my question is for you. I just have one question.
Sure.
We're getting reports where we're getting stories, some people who are in the facilities, and we're also getting the government stating that, the facilities are up to standard and everyone should be comfortable. I just wanted to know what advice you have for those in the public who may suspect that they have COVID-19 virus, but because of the complaints that are coming out of the facility, they might be afraid to get tested.
Okay.
Is there any advice you would have for those people then?
So the Chief Medical Officer will take that question.
So basically the concern that you have should be overridden. Whatever concern that you may have should be overridden by the fact that if you have severe disease, you can die. So what we have been saying from the start of it is that if you have any shortness of breath, you have fever, cough, especially if you fall within those high-risk groups, testing is the appropriate thing to do. So you know, one, what you have, and two, that you get the appropriate level of care. We have seen in other parts of the world that persons have not sought medical attention early enough. Even in Trinidad, people presenting late, it is very difficult for us to reverse the process, the pathologic process, when you present late to the healthcare facilities. So we are calling on everyone, if you have mild to moderate disease, even you can present to us, we will test you. Forget about the institutions. It is most important that you are tested and you are treated appropriately so that the chance of survival is much greater.
Thank you. Who is next? IETV.
Good morning, everyone. Binami here from IETV. I have two quick questions. The first one goes out to the Minister, or by extent, the CMO. Minister, what protocols are in place for persons who tested positive but may refuse to stay at the various facilities, citing poor conditions or conditions that don't meet their standards? Are there any protocols in place to deal with such patients, as well as forward this question to your colleague, the Public Utilities Minister?
Sure.
Many persons in the public domain is complaining in terms of water. Their water supply is very low. Their water schedules is not up to par in terms of sanitizing and cleaning. They need water. So is that situation being addressed as well? Thank you.
So I will certainly pass on your concerns to Minister LaHunt, and I will allow the Chief Medical Officer to deal with the other part of the question.
Okay, so our national policy as it relates to anyone that has tested positive at this time is that you have to be within an institution. The two institutions that we have that have positive patients at this point are Cora and Cuva, those facilities have adequate capacity at this time to house and treat any person that is positive. And as I discussed before, we are not only putting you in those facilities to ensure that you get the best level of care, which is primary, but we are putting you in those facilities to ensure that there is no spread to your family and to the community, and to be certain that you are quarantined and isolated. In so doing, decrease the risk of spread to the rest of the population. So, as you have said, there is the Quarantine Act, which actually gives us that remit when you have an infectious disease, which has been added on the 31st of January. COVID-19 has been added to the quarantine schedule in Trinidad and Tobago, so it is a quarantinable disease. So that's where we stand in terms of that question.
Newsday.
Hi, good morning, everyone.
Morning.
Good morning. Olive Gonzalez from Newsday.
Yes.
I have two questions. One question has two parts. The first question is mostly for the CMO. I would like to know how far is CAFA with the validation process for private labs?
Mm-hmm.
The second question, I would like to get an update on 3 patients from Balandra quarantine facility. I would like to know if CAFA has been able to verify if their positive tests were in fact false positive. And I would also like to know if CAFA was able to explain the reason for these false positives.
Okay.
Thank you.
So the first question, the second question about the Balandra cases, I'd asked the CMOH to actually provide me a summary of the cases, and her suspicion is basically close contact with persons that would have been within the facility and tested positive. So that is in terms of her reporting, and which I alluded to previously, that is her suggestion to me. I have forwarded that report to PAHO as well for them to have a look at it, to give us consideration regarding any other scenarios that they would suspect based on their expertise. In terms of validation, the process as we laid out maybe last week in terms of our press release, it's basically the Ministry of Health leads the process of validation, wherein any lab that wishes to be part of the process and is a quality assurance process, they submit their necessary documentation to the Office of the Chief Medical Officer. PAHO has given me support in terms of a quality assurance team, as well as CAFA has given me the support in terms of technical validation and technical oversight for that team. So we have actually received a couple submissions thus far, which will be forwarded onwards to CAFA and PAHO to have a look at it. And of course, site visits are part and parcel of the validation process. So that has begun.
Astronaut Health News.
Good morning, Gwyneth Stewart from
Hi,
Astronaut.
good morning, Gwyneth.
Good morning.
Good morning, everyone. My question has to do with, has the government identified any key industries that would be needed in our economy to assist with long-term survivability of us as a nation? And also, has there been any collaboration with the Ministry of Agriculture in terms of local food security in the long term?
Okay, so the issue of food security, the Minister of Agriculture is firmly engaged with that issue, and he will probably best answer your question. The first part of your question, we are asking all of society to come together, and that is why at the start of this press conference this morning, I abhorred the public spectacle, the public political spectacle of politicizing COVID and playing it out in the public domain. It does not help. It is contrary to saving lives. It is unproductive. It does not assist. It detracts from the national effort. So yes, we want to engage with every sector of society. And I'll tell you something, Gwyneth. Every sector of society has come on board with the exception of one entity. Just one entity that is hell-bent on destroying Trinidad and Tobago by politicizing this issue. The virus is not yellow. It is not red. It is not labor. It is not belonging to any religious order. It will take down prince to pauper. It respects no boundaries. And if that one entity that is hell-bent on destroying us, then heaven help us. But so far, with the exception of that one entity, everyone else, Gwyneth, has come full on board. And I want to congratulate Trinidad and Tobago for being part of a national effort. Thank you very much, Gwyneth.
Doctor? You okay? Yeah. Okay. 103 FM.
Hi, good morning, everyone. Can you hear me clearly?
Yes, we're hearing you clearly.
All right, I have two questions, and as we're on the topic
Identify
of
yourself, please.
Sorry, it's Rai Rikomas from 103 FM.
Thank you.
As we're on the topic of public discussion, I've seen a lot of comments online and in the public about people saying that they just feel it's their opinion that there are more cases than being let on by the ministry. Can either one of you respond to that? As well as I've seen that Antigua has introduced hazard cash payments to frontline medical staff, while Jamaica has introduced mobile testing units. Are any sort of incentives, initiatives like that being considered for Trinidad and Tobago?
So I will take the second part of your question, and the Chief Medical Officer will take the first part. Once we have the capacity, which I am hoping to get up, we will start mobile testing. We are waiting for the extraction kits. We have 4,000 tests waiting, but they did not come with extraction kits. So we could do that as far as mobile testing is concerned. The other part of your question, that is something that other members that we will look at, but I can make no promises at this point in time.
Thank you very much. Doctor?
No, he had a...
Yes, so in terms of the surveillance part of it, of any disease that we have, you have a certain number of people that will come forward, that will present with an illness. So those are usually people that have, I would say, moderate to severe disease or are critically ill. They will present to the healthcare facilities. There are a group of people that generally either have no symptoms at all and are infected in any disease. We saw it for Zika, you saw it for, there's those groups of people for dengue, there's for influenza as well, that have very, very mild disease. So you'll have mild disease for a couple of days. You may not even believe that you actually have a real symptom. Those are called asymptomatic to mildly symptomatic people. That oftentimes is difficult for a surveillance system to pick up, because in order for us to test someone, they must present to the healthcare facilities. So by way of drive-through testing and those sorts of initiatives, what we do, and increasing the surveillance, what we find is basically that you get those people with milder disease being willing to drive through and come into the system more quickly. And that's why we're looking forward to that sort of initiative, and we have started the community initiative with looking to see if we have any other pathogens around. So there's the whole issue of asymptomatic spread, which we are all concerned about, and that's why we have the stay-at-home order in place. So persons, we have the stay-at-home order, we have the wear masks for those reasons. There's the research that suggests that 2 to 3 days prior to developing symptoms, persons can spread the disease. In a case like that, when you wear a mask, you actually prevent that spread even before you know it to members of the population by droplet infection. So we'll be looking at, and that's why we have the stay-at-home, we have all the public health measures in place, because we don't know if you have asymptomatic carriers walking about spreading the virus, and those people can become super spreaders in the community. They can become what I have discussed before as hidden carriers, and that is why we have these rigid measures in place. So if we minimize the movement of people and we take the other public health precautions, we can decrease the likelihood of having those super spreaders go about and create community spread. Yesterday I would have given WHO and WHO an update as to the status of Trinidad. There are different categories. We are listed as sporadic spread at this point when I related back to them as the IHR focal point, meaning that we have cases related to travel, as well as we may have a couple local cases here and there, but there is no mass community spread at this point. We continue to increase our surveillance, both in terms of not only testing, in terms of symptomatic case definitions. We are broadening our definitions to include greater sensitivity for persons who would have had contact with travelers, contact with suspected cases, contact with confirmed cases. And as I said before, we are looking at primary, secondary, tertiary contacts and asking those people to stay at home. The critical thing is looking for the hidden hidden persons that will spread this all around, and getting those people to stay home before they even know that they have the virus.
The Minister of Health will now give a closing statement.
Thank you very much, Minister Cox. I just want to take off on where the CMO left off. This issue of what is a super spreader. Without calling any country's name, there's one country where one person, because of religious activity, spread the virus to 40,000 people. Let me repeat that. One person in a religious setting spread the virus to 40,000 persons. I hope that is sinking into the psyche of Trinidad and Tobago. That is a super spreader. What we are trying to do in Trinidad and Tobago at this stage of the game is to stop the second and third waves of this disease. And Dr. Carissa Etienne yesterday issued a stern warning and piece of advice to the entire CARICOM area. If you are not prepared as yet, the clear and present danger posed to CARICOM is serious. If we do not heed the warnings of the Honorable Prime Minister, come down, we will lose this fight. But I am confident that the vast majority of citizens of Trinidad and Tobago are sensible, are taking the necessary measures, and they will resist the politicization and the public spectacle and the freak show that now accompanies this global pandemic of which we are a part. We must stand united, because if we don't, we are going to add to the global pandemic. We will be spectacular in our numbers. I am urging all to resist the temptation to politicize this matter and to fight it and to fight legal battles in the public domain. You are not helping. You are becoming part of the problem and not part of the solution. So Trinidad and Tobago, to the majority of citizens, I thank you for your endurance in this marathon. I salute all the responsible people who have heeded the calls to stay home and stay safe. And if we stay together, I promise you, we will come through this as a better people. Thank you very much, Minister Cox.
Thank you very much, Minister Dialsing. And we have come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. But as we leave today, we wanted to say thank you to everyone who continues to follow the government's guidelines and stay home. Your efforts have led to the success Trinidad and Tobago has experienced thus far in slowing the spread of COVID-19. Let us use this time in isolation to forge closer ties with our loved ones, leverage new technology, and reflect on what we can do for our beloved country. Thank you, Trinidad and Tobago. I am Donna Cox, Minister of Communications. Thank you for joining us today.